Hi, this is Dr. Kavitha Battula, gynecologist from Vijayawada. Now we are going to see hysteroscopy for a postmenopausal lady. She has fluid in the endometrial cavity minimal and a hyperechoic area. So we have seen the tight internal os. We can see the scissors, micro scissors cutting bit by bit of the tight internal os on either side. So here we cut and we are trying to enlarge the internal os. We are cutting on the other side of the internal os. In postmenopausal women, because the uterus is very atrophic and the cervix also is very atrophic, sometimes the uterine cavity is not aligned with the endocervical canal and internal os. They are at high risk of uterine perforation. Also, there may be a deflected uterus from the endocervical canal. So we are trying to enter the uterine cavity by incising the internal os as seen here. Still we have not entered into the uterine cavity. We are trying to cut on either sides. So going a bit by bit incision, but we are not able to see the cavity. If we are going into a false track, we can see the ragged part of the false track. It's not a smooth cavity, so we can identify in that way the part of the cavity just above the level of the internal os, it will be ragged. So that indicates that we are not in the right direction. We are onto the right side of two supposed cavities, but it wasn't like a normal cavity. Another thing is like once we incise and there is a small entry into the cavity, the normal uterine cavity enlarges and the entry becomes bit enlarged. So there is we can identify the correct uterine cavity and the correct path. Here we are trying to identify which one is the correct cavity or the entry. There are two on the either side. It was something like this right side was something like a not so appropriate or not so correct cavity. So we are trying to go to the other side. So this is the other side. We can see a film of tissue covering the cavity. Here trying to incise that film of cavity. So here we have incised, and then we can see the fluid coming out and going in, the thick kind of a brownish fluid in the uterine cavity coming out. So we can identify, we can know that it is that side is the uterine cavity. And once we incise and dilate it, we can go inside and see further ostia, both ostia. That confirms that that is the uterine cavity and the internal os. Thank you very much. Go ahead and watch the rest of the video.